Right now at one of the most prestigious hospitals in America, an artificial intelligence system just completed a diagnosis that took human doctors 3 hours. The accuracy? Perfect. The speed? Instant. And this isn't a futuristic scenario. This is happening today. In May 2026, researchers at Harvard Medical School just published a groundbreaking study. They took an AI model from OpenAI, gave it patient records, and had it compete against experienced emergency room physicians. What happened next shocked everyone in medicine. The AI didn't just match the doctors. It beat them. Significantly, this is what happens when machine learning meets medicine. And the implications will transform healthcare forever. The Harvard study. The study is published in Science magazine. Not a tech blog. Not a startup press release. Science. The most prestigious peer-reviewed journal in the world. Here's what researchers did. They took an OpenAI reasoning model, the company's most advanced AI system. They gave it electronic health records from Boston Emergency Department patients. Real patients. Real medical histories. Then they asked the AI to diagnose these patients and manage their care. On the other side, they had experienced physicians doing the exact same thing. The results were quantitative and shocking. The AI model outperformed experienced physicians. Not by a small margin. By a significant margin. The physicians had years of training. Decades of combined experience. Board certifications. And the artificial intelligence, trained on data, beat them. For diagnosis accuracy. For patient care management quality. For identifying the right treatment path. This is the first time in human history that an AI system has been formally proven superior to human doctors in a peer-reviewed study. How the AI works. The model OpenAI created uses reasoning. Not just pattern matching. Not just correlation. Actual reasoning. Think of it like this, a traditional AI model sees symptoms and pattern matches to diagnosis. If patient has chest pain and shortness of breath, database says heart attack. But the reasoning model does something different. It thinks through the problem. It considers patient age, medical history, medication interactions, genetic factors, environmental factors. It weighs probabilities. It eliminates possibilities systematically. It synthesizes information like a doctor would. But faster. And without emotional fatigue. Human doctors work 12-hour shifts. By hour 11, cognitive performance drops. The AI never fatigues. Never gets distracted. Never has a bad day. The system evaluated electronic health records from Boston Emergency Department. These are complex cases. Real patients with multiple comorbidities. Multiple symptoms. The AI had to synthesize all this information and make diagnostic decisions. And it was more accurate than the human physicians who had physical examinations, patient interviews, clinical intuition. The model processes information at computational speed. It compares against millions of data points simultaneously. Implications for medicine. This changes everything. In America, there are critical doctor shortages. Rural areas don't have specialists. Emergency departments are overwhelmed. Wait times for diagnosis are weeks. With AI diagnostic systems, a patient can get a diagnosis in minutes. Not hours. Not days. Minutes. At a fraction of the cost. No travel to major hospitals. No waiting for specialist availability. Every hospital could have access to world-class diagnostic capability instantly. But here's the bigger implication. Mistakes. Human doctors make diagnostic errors constantly. The Journal of Medicine estimates diagnostic errors cause 40,000 deaths per year in America alone. 40,000 deaths from misdiagnosis. An AI system with superior diagnostic accuracy could prevent thousands of these deaths. It could catch early-stage cancer that doctors miss. It could identify rare diseases that get misdiagnosed 5 times before correct diagnosis. This isn't about replacing doctors, it's about augmenting them. Doctors plus AI together would be unstoppable. But, there's a darker timeline. If hospitals automate diagnosis entirely, what happens to human radiologists, pathologists, diagnostic specialists? The job market shifts. The economic disruption could be massive. Concerns and reality check. Now, before you think AI doctors are taking over, there are important limitations. This study was specific. It was diagnostic accuracy on electronic health records. Real medicine is more complex. A doctor builds rapport with patients. Patients disclose symptoms to doctors they might not disclose to a form. Doctors have intuition developed through years of experience. They notice subtle signs that AI might miss. Physical examination is crucial. You can't diagnose appendicitis through a computer screen. So AI won't replace doctors entirely, but it will change how medicine works. The FDA is already approving AI diagnostic tools. The medical establishment is slowly accepting that AI can assist in clinical decision-making. But regulatory hurdles are massive. Liability questions are unresolved. If an AI system makes a diagnosis that leads to wrong treatment, who is responsible? The hospital? The AI company? The doctor? These legal questions will shape adoption. What's clear is this: AI in medicine isn't coming. It's here. And it's already better at some things than we are. The future of medicine is being written right now, in Harvard labs, in hospital systems, in AI research companies. If you want to stay informed about how AI is transforming every industry, subscribe. Every week we dive deep into the breakthroughs that will reshape your world. This is just the beginning. Hit that notification bell.